gratitude to make an important announcement that we are here with some members of our newly formed COVID advisory group, and also to provide some updates from Dr. Bisola Ojikutu on the latest COVID data in Boston. This amazing 17-member group will be chaired by Dr. Bisola Ojikutu of the Boston Public Health Commission and be charged with advising us as we look to take every possible action to end the pandemic. We're now entering year 3 of this public health emergency with new variants continuing to emerge, and it is clear that we need leadership from every sector to help us take on this public health crisis with immediate steps. That's why I'm so grateful to be here with experts from across disciplines, industries, communities in Boston who will partner with our team to implement best practices, follow the science, and work together to move us forward in our recovery. This is an uneasy time. I've spent the weekend on a 15-hour holiday trolley tour across the city of Boston, getting to see residents in every single neighborhood. And we are in a moment where people are eager and excited to be back in community, to be coming together, but also looking ahead and watching the news and needing to see that we are taking clear action and making sure we're all protected and safe in this moment. The first Omicron case has just been detected in Massachusetts, and we are seeing an anticipated holiday surge in COVID cases. We will continue monitoring the situation extremely closely and follow the science at every turn. As we did all weekend and will continue to do, I urge Bostonians to get tested, to get vaccinated, to get boosted, and to work with us to close these gaps so that every person has easy access to the public health tools they need. So today is about our advisors and the incredible wealth of expertise, community relationships, and heart for the city of Boston that they represent. Before passing it over to Dr. Ojikutu, I'd love to ask if each member who is here could just quickly come and introduce yourself at the podium, and then I'll read the names of folks who could not join us here as well.
Hello, good morning. Thank you for having me here. Thank you, Mayor, and for having us here today. I am Sabrina Assoumou. I'm an infectious disease physician at Boston Medical Center, and I'm also an assistant professor at Boston University School of Medicine. Thank you.
Good morning. My name is Temple Gill, and I'm the Director of Public Affairs and Strategic Partnerships at the Huntington Theater Company. And I'm proud and grateful to represent the arts and cultural community.
Good morning, I'm Reverend Liz Walker, Roxbury Presbyterian Church, and honored to answer the call.
Buenos dias, good morning. My name is Immunology Paulino. I work as the CEO of La Colaborativa. Honored to be here. Thank you.
Good morning. My name is Julia Kohler. I'm a pediatric infectious disease clinician at Children's Hospital, a molecular biologist, and I want to thank the mayor for this important initiative.
Thank you, Mayor Wu. My name is Tony Chan, venture investor, entrepreneur, founder of Minilux in Boston, helping to represent one of the largest vocational class in personal care outreach.
Good morning. My name is Nia Grace, representing an entrepreneur in the restaurant and hospitality space. Daryl's Corner Bar and Kitchen, the Underground Cafe, as well as a co-founder of the Black Hospitality Coalition.
Thank you, Mayor Wu. My name is Brian Moy. I am an entrepreneur and restaurateur representing China Pearl and Shoujo Restaurant Group, and glad to be part of this committee to better serve the community. Thank you.
Good morning, buenos días. Mi nombre es Paola Garcia, and I represent, I'm Community Relations Manager for TAP Senior Care Option.
Good morning, I'm Jake Sullivan from Boston University's Office of Government and Community Affairs. Thank you, Mayor Wood, for having us.
Thank you so much to everyone who could be here today. I'll read the names of our members who could not join in person today. Dr. Kizzmekia Corbett, Assistant Professor of Immunology and Infectious Diseases at the Harvard School of Public Health. Mr. Louis DeLisa, President of the Garrison Trotter Neighborhood Association and member of the Black Boston COVID-19 Coalition. Yvonne Garcia, Chief of Staff at State Street. Amy Latimer, President of TD Garden. Dr. Cassandra Pierre, Medical Director of Public Health Programs at Boston Medical Center, Dr. Sandro Galea, Professor at Boston University School of Public Health, Dr. Joseph Betancourt, Senior Vice President in Equity and Community Health at Mass General. So now I will turn it over to our cabinet member, our fearless leader on everything related to COVID-19, public health, and so much more in this urgent moment, Dr. Bisola Ojikutu, Executive Director of the Boston Public Health Commission.
Thank you, Mayor Wu, and good morning, everyone. As is the case across the Commonwealth and nationally, we are currently in the midst of an anticipated COVID-19 winter surge. COVID-19 cases and hospitalization are up, while vaccination among some of our most vulnerable populations is lagging behind. To address this threat, Boston is focused on 4 key strategies: increasing access to vaccination and boosters, increasing testing, enhancing health communication, and doubling down on prevention. So let me start by telling you some of the numbers. Our citywide COVID-19 positivity rate is currently 5.2%. Compared to 2 weeks ago, that's a 15% increase across most Boston neighborhoods and across all racial and ethnic groups. With this increase in cases, emergency department visits and hospitalizations are up compared to 2 weeks ago. It is important to note, though, among hospitalized individuals, approximately 2/3 are unvaccinated. Measures taken by our local hospitals, including reducing the number of non-urgent procedures, will ensure that capacity and resources remain available if needed during the surge. Turning to vaccination. According to one study led by the CDC, unvaccinated individuals have a 5-fold increased risk of being infected, a 10-fold increased risk of hospitalization, and an 11-fold increased risk of dying from COVID-19. So let me make this clear, vaccination is critical to ending this pandemic. Thanks to our community-based partners, our vaccine equity grant recipients, and dedicated community health centers, hospitals, and pharmacies throughout the city, significant progress has been made in Boston. 67% of our overall population is fully vaccinated. But protection from vaccines wanes over time, and boosters are a key component to maintaining strong immunity against COVID-19. The problem is that only 21% of fully vaccinated Bostonians have received their booster. More than half of individuals over age 65, our elderly population, have not gotten a booster. And 84% of individuals under the age of 65, many of whom are direct service providers, teachers, healthcare workers, and other essential workers employed in high-risk settings or who have underlying medical conditions, have not been boosted. In addition, of great concern is the low vaccine uptake among 5 to 11-year-olds in Boston and the significant racial and ethnic disparities that we have noted. At the beginning of December, only 1/4 of all children in Boston ages 5 through 11 received 1 dose of COVID-19 vaccine. While almost 60% of white non-Hispanic children have been vaccinated, only 35% of Asian, 10% of Latinx, and 7% of Black children have received their first dose of vaccine. There are many factors that are driving these disparities, including parent and guardian concerns regarding safety, mistrust, and limited awareness about the vaccine and its need in this age group. That is why the city is making every effort to build awareness, access, and capacity. Before I describe the citywide plan that I mentioned when I opened, I want to say a few words about the Omicron variant. As we're all aware, and as Mayor Wu mentioned, this Saturday the first case was detected here in Massachusetts. The patient was fully vaccinated, and by report, the patient's symptoms were mild and they have not required hospitalization. Robust immunologic and clinical data are not yet available to provide conclusive evidence of whether Omicron will be more transmissible, cause more severe disease, or circumvent protection conferred by our current vaccines. But we do have some concerns. There is epidemiologic data, specifically the significant increase in cases in South Africa, suggesting increased transmissibility. The number and pattern of mutations involving the spike protein suggests increased transmissibility. And there's also some evidence to suggest that the Omicron variant may be able to evade immunity from prior infection, therefore increase the risk of reinfection. But I think it's important to note that our ability to detect Omicron in Massachusetts is exceptional, due to the work at the Broad, our state lab, and other laboratory and academic partners. Massachusetts sequences the 3rd largest number of samples out of all states in the United States for variants, and we can increase our capacity. More data are needed before we can answer any questions conclusively, but we're monitoring the situation very carefully. In this time of uncertainty, it's important to remain vigilant, but also to be calm. And most importantly, get your vaccine if you haven't, and receive your booster shot. Booster shots provide a high level of antibody as well as increased levels of other aspects of the immune response, which strongly suggests that vaccination will give you some cross protection against a number of variants. Okay, so let me turn to our citywide response. Boston is focused on 4 key strategies. Strategy number 1, increasing access to vaccination, including boosters. So we're going to double down on our efforts to increase citywide vaccination by making vaccine clinics more accessible throughout the city. Anyone who wants a vaccine or a booster must be able to get one. So where should you go? So we're currently supporting 7 walk-in clinics in Dorchester, Mattapan, Roxbury, Hyde Park, and Roslindale where no appointments are necessary. You don't need to go online, just go. At these clinics, anyone can receive a booster, and people 5 or over can receive their first or second dose of vaccine. We're also collaborating with our community partners to establish higher capacity vaccine sites ahead of the winter holidays. 4 of these higher capacity sites are planned for Saturday, December 11th, December 18th, and 2 Saturdays in January. The first of these larger capacity clinics will be held in Vine Street Community Center in Roxbury. We are also setting up a site here at City Hall on Thursday from 10 a.m. to 5 p.m., 3rd floor, where we are right now. This site is open to the public, not just the city workers. We will announce additional locations throughout the week, and for more information, call 311 or go to boston.gov. I also think it's important for us to mention Boston Public Schools. We need to increase our vaccination amongst our children. Students and their families will have increased access to clinics at schools across the city throughout December and throughout January, thanks to partnerships with BMC, MGH, and Tufts. Additionally, the Commission is providing dedicated clinical leadership through Dr. Sarah Sanchez, Director of our Infectious Disease Bureau. She will essentially be detailed to BPS to work on understanding and developing new policies regarding COVID-19 mitigation in our schools and scaling up the school vaccination program. Turning to strategy number 2, increasing access to testing. We need to increase access to testing, especially in our hardest hit communities. To do that, we have recently purchased and will be providing 20,000 free rapid antigen home tests to communities where we have noted the highest rates of COVID-19 and high barriers to purchasing test kits on their own. With the help of our vaccine equity partners and other community-based organizations, we will be distributing these free test kits as well as masks during the holidays, actually prior to the holidays. Each kit will include information on what to do if you test positive and direct you to contact the Commission's Infectious Disease Bureau to report your positivity and to receive additional instructions. Turning to strategy number 3, it's increased healthcare communication. So we're redoubling our efforts to increase information access about vaccines and boosters for all ages, especially children. Most of this work will involve our vaccine equity partners who are funded to lead community outreach. I want to mention our vaccine equity grant participants because really they have done a lot of the boots on the ground work to get vaccination increased in our communities. So they are the Black Boston COVID Coalition, BMC, Mattapan Community Health Center, East Boston Neighborhood Health Center, Harvard Street Neighborhood Health Center, Equity Now and Beyond, Chinatown Collaborative, Greater Boston Latino Network, Boston Centers for Youth and Families, and Four Corners Main Street, as well as many others. We're also partnering with other city departments to educate Boston residents, and that includes the Office of Emergency Management, Age Strong, and Boston Housing Authority. So lastly, but certainly not least, we need to redouble our efforts to prevent the spread of disease, particularly in light of this new variant. The city's indoor mask mandate will remain in place. It applies to all indoor establishments that are open to the public. And as I mentioned, we will be giving out masks with rapid test kits throughout those communities where we've noticed higher risk. And as has been the case throughout the pandemic, physical distancing, hand washing, and proper ventilation remain critical for preventing the spread of COVID-19. In addition, please monitor yourself and your children for COVID-19 related symptoms. And also, if you haven't already, get your flu shot. I look forward to working with Mayor Wu and our new COVID-19 Advisory Committee and many other partners throughout Boston on these 4 strategies and to address health inequities to keep our residents safe. I believe that a return to normalcy and a brighter future are within reach. Let's work together to keep Boston and Bostonians safe and healthy. Thank you.
We are working closely with the state on statewide policy, and Dr. Ojikutu, as you've heard, is in daily contact with our hospital partners as well and healthcare partners as well. Everything is on the table right now as we really seek to make sure that Boston is taking steps to head off the surge headed into this season and to make sure we're investing in our public health infrastructure in the right ways as the pandemic continues.
Looks like you're expanding the clinics. You talked about higher capacity. This is including boosters, correct?
Absolutely. So we have what we're calling family-style clinics that we're supporting in different communities around the city of Boston. And at those clinics, people will be able to obtain a booster or their primary first or second dose of their vaccine series, and that is also for children 5 to 11. So it's really a one-stop shop at those particular clinics. At the higher capacity sites that we're planning to open, 2 in December and 2 Saturdays in January, it's going to be the same format, so everybody can come and get their booster, whatever it is they need.
Are you finding everyone sort of anecdotally is talking about having a hard time finding booster appointments. Are you getting that as well? And is there an issue with staffing and trying to sort of increase that capacity?
Right. No, I think those are great questions. And yes, we have heard that people have had challenges obtaining booster appointments. That was one of the motivations for us having these walk-in clinics. There's no online component to it. You show up between the hours that are available on boston.gov, or you call 311 or the mayor's helpline and get the information, and then you just come and get your vaccine. So we're trying to get rid of the barriers that we think are stopping people from obtaining boosters or childhood vaccines or anything really.
Well, they've had a little staffing. I'm sorry.
So yes. So I think that we are working very hard with our clinical partners in terms of staffing. The answer is yes. We could always use more clinical partners. We have some very, very dedicated both hospital and other folks who've been doing vaccines, sort of throughout this period of time where we're trying to scale up. But certainly staffing is an ongoing issue.
Will there be a city residence requirement for these clinics?
No, we haven't put that in as any sort of requirement. I think that's an interesting point, but the reality is that we just want to get people boosted. There are no boundaries to this virus, So we know that at some of our clinics the past few weeks, we've gone without vaccinating people because people haven't shown up. So what we're really trying to do is get the communication out there and just get people vaccinated.
You mentioned increasing vaccinations through schools. Can you put a number on what that increased capacity will look like?
I cannot put a number on it, but we have basically set up vaccine clinics with our clinical partners, BMC, MGH, and Tufts, at schools throughout the Boston Public School System. Those have already started, and we'll be running them throughout December and January and beyond as needed.
Who are leaders in their various communities, and it's just going to take perseverance against something that is relentless. So if the problem is relentless, then we have to be relentless in our approach. And it's the same solution that it was a year and a half, when the vaccines first came out. We just can't give up for our children and for our future. So we have the right people, we have a plan, we just have to keep at it.